The Honorable Minister, thank you very much for your words. Much of what I have to say is a message of hope that builds on your excellent results to date. I'm very inspired by what you've done with your National Health Service, with your public health policies. They are truly an example for the rest of the world, and I congratulate you on what you have done. So the challenge of chronic diseases, age-related chronic diseases, and cancer in particular is an extremely significant one. By the year 2025, there will be 1.2 billion individuals over the age of 60. And the significance of that is that beyond 60, every 5 years, the incidence of cancer, diabetes, heart disease, and Alzheimer's doubles. So that by the time you're 85, you have a 40% chance of getting cancer, a 45% chance of getting Alzheimer's. These are very significant burdens for all emerging countries and developed countries as well. These are very, very significant issues. The generational cost of cancer alone is $100 trillion globally, and over the next 10 years, 100 million lives will be lost to cancer. And those are dire statistics, but there is also great hope. I believe that history, when it views this time, decades from now, will see it as a turning point in how we truly conquered cancer. This is a true revolution, a revolution that is fueled by knowledge, insights into what causes cancer in the first place, but as was mentioned, a technological revolution that will allow us to disseminate knowledge, to democratize care, to enable individuals to take greater control of their health, and to allow us to deliver the right kinds of strategies to the individual where they are, where they work, where they live, in a way that reduces healthcare costs and improves outcomes for all. And I mean all. And it's very important to appreciate that our solutions are in hand. We have the knowledge today of what causes cancer. That knowledge could be converted into new policies, education, and services that, in the case of cancer, would allow us to reduce up to 50% of cancers. Half of all cancers do not need to occur in the first place. And because we understand what causes the cancer, we now recognize that actions actually need to be taken during childhood. We view cancer as a cancer of the aged, but the problems are the seeds are planted during childhood. The vast majority of adult smokers start as children. This nation's raising of the age to 21 is an extraordinary step forward. Also, the increasing of taxes on tobacco products is critically important. Plain packaging. These are all very important opportunities. There's also a major shift in the ability to actually lead to tobacco cessation. Self-quit success is only 6%. Tobacco treatment programs at MD Anderson are 45%. So with the right policy and the right access to services such as tobacco cessation, we can have a profound impact on one of the major causes of preventable death and disease worldwide. 20% of all deaths are tobacco-related. 30% of all cancer deaths are tobacco-related. We also have, in the case of cancer, infectious diseases that fuel the development of cancer. And here again, we must act during childhood. This nation's mandating the vaccine for HPV, human papillomavirus, is a major step forward this year for girls and next year for both boys and girls. This is an enormous step. 5% of all cancers are caused by that virus. Cervical cancer and many throat cancers can be eradicated in much the same way that we eradicated polio. And it takes the concerted effort of the government and society to be able to make that gift of science a reality. Many of these things, childhood obesity, another major cause. In the United States, obesity will surpass tobacco as a major cause of cancer by the year 2020. We also have a period of vulnerability for children with UV. That is, excessive sun exposure during childhood could fuel the development of melanoma and other skin cancers much later in life. So that knowledge is knowledge that can be converted into action, and it's going to require technology, the ability to use cloud, mobile connectivity, artificial intelligence to do personalized prevention. That is, you understand what your risk is based on your family genetics, based on your behavioral characteristics. All of those could be used for precision prevention. And that is the greatest investment that any government and society can make, because it is extremely cost efficient, and most importantly, it reduces needless pain and suffering. There is also a technological revolution that's occurring in the early detection of cancer. The advances in imaging physics, in nanotechnology, our ability to mine the proteins in the serum, which is incredibly complicated, is now providing us with new biomarkers to detect cancer at early curable stages. I predict that within the next 20 years, there will be a simple and inexpensive blood test that everyone over the age of 50 will get that will be able to detect the major cancers. And essentially, since almost 1 in 2 of us will develop cancer by age 80, such a test would be able to have us catch cancers at earlier, far more curable stages. So a revolution in detection can dramatically reduce the mortality due to cancer, and again, the expense of treating a stage 1 cancer versus stage 4 is very, very different as well. So the economic impact is also good. So prevention and detection are critical investments where knowledge, dissemination of knowledge to the schools, school-age children, to the parents, to the educational system and the healthcare workers, extremely important. To close that knowledge gap is very, very important. And now treatment. Now I'm going to tell you that MD Anderson sees many patients from around the world. In fact, 70% of the patients that we see come from elsewhere, not from the surrounding region. And when they come to us, often diagnosed, since we see so many patients, we have subspecialization. We are a comprehensive cancer center that does what we call multidisciplinary care. So if you are a breast cancer patient and you come to MD Anderson, you get seen by a team of physicians and workers and diagnosticians that only see breast cancer. So that drives an enormous amount of expertise. For those patients that come to us, 24% of the diagnoses are inaccurate. 38% of the cancers are misstaged. Half of it due to technological inefficiency, half it due to misreading of the scans. And if you get the diagnosis correct, the difference in outcomes at 5 years is 17% better at a comprehensive cancer center like an MD Anderson or a Sloan Kettering, as opposed to even good medical centers in the United States. And so what that teaches us is that there's a tremendous amount of opportunity to reduce inaccuracy in diagnosis and to improve the quality of care. And that can come through a variety of different strategies. I would strongly recommend that every nation have a center of excellence. Every nation should have a comprehensive cancer center, an MD Anderson-like cancer center or a Sloan Kettering-type cancer center. Similar in heart, having a Cleveland Clinic or Texas Heart. Very important because it drives expertise, and that knowledge can then disseminate throughout the entire region and nation and the world. And so that's a very important thing to appreciate, that cancer is among the most complicated diseases to diagnose and to treat, and it really takes a team effort and significant technology. Now, technology can bridge that gap quite significantly. I believe that, and with all due respect to the great pathologists here and those at MD Anderson, The capability of image recognition science is now on par with expert pathologists in reading pathology slides. The capabilities of us to sequence genomes for pennies relative to what we used to do in a clinically actionable time frame is also enabling us to more precisely not only identify the type of cancer, but the molecular architecture of that cancer so that we can apply the right drug to that patient. It's similar to antibiotics where we do culture and sensitivity. We give the right antibiotic for the infectious agent. Cancer is no different. You must apply the right drug based on the underlying disease architecture.